Dr. Fong, let's talk a little bit about cosmetic dentistry. Actually, let's talk about veneers and lumineers, which are usually used to do cosmetic dentistry to change the face of the look of a person. But what's the difference between a veneer and a lumineer? You hear advertised lumineers, and it just kind of, most of us, I'm always very confused. What is the real difference between those things and how they're differently used in the mouth?
Well, first of all, a veneer is a dental restoration that is bonded to the front surface of the tooth. And so a lumineer is essentially a veneer, but it is a patented porcelain technology that enables us to be able to be very minimally invasive when it comes to preparing the tooth and to get it ready for bonding for that restoration. The porcelain is of contact lens thinness. It's patented, and so it enables us to be able to place a restoration on there and beautify, correct the tooth, and make it look much more healthier. The wonderful thing about porcelain veneers, or I should say lumineers, is that it allows us to be able to improve and enhance the cosmetics of discolored teeth, permanently stained teeth, broken or misshapen teeth. We're even able to bond these restorations to crowns or existing bridges without having to remove them. So it enables us to be able to help an individual correct and enhance their smile.
So basically, literally, you can change it. If a person thinks that he has too short or too long teeth, or too narrow or too wide teeth, you can, so to say, change that. Never mind, of course, the particular shade of color a person might want, right?
That's right. We can do that with either a veneer or a lumineer, yes.
Yeah, so basically a veneer and a lumineer, from what you say, is really kind of the same thing. It's just a different brand, and the lumineer in general is much more thin, so you need to do less grinding on the tooth
right.
in order to sometimes to glue it on. But more or less, a patient, from what you're saying, really doesn't need to concern himself too much. If the dentist can put a veneer on it, or must put one, or can put a lumineer, or must put, he'll know. And in terms of looks and functionability outside for the patient, it's all one and the other.
Yeah, that's right. Those are the options for the individual. Probably the most important thing that someone would want to know as far as the difference between a lumineer and a veneer is that more than likely the lumineer allows us to, like I said, be more conservative in removing less tooth structure. Actually, we probably don't have to remove any sensitive tooth structure. There's hardly any pain involved with it, and also there's no need for injecting the tooth and making it an uncomfortable situation for the patient.
Now, tell me, I have heard the word, that veneers and lumineers, now that we know it's pretty much the same thing, we don't have to worry about it, veneers or lumineers, that they're also called a instant orthodontic work, an instant ortho work, basically, where normally you go, you get braces, they have these days invisible braces and all that stuff, wonderful, but nevertheless, you need to wear them for, months and months, sometimes a year or two, it all depends, and a lumineer can avoid all that and just make it pow instantaneously. How is that?
Well, depending on how crowded the teeth are or how rotated the teeth are, if it's very minor, then we could use lumineers to just reshape and recontour the teeth, and then be able to use the lumineer to improve the alignment, shape, and correct basically the looks of the teeth there to make it look like orthodontics have been done. And then that helps to improve and enhance the smile itself.
I see. So if a person has a couple crooked teeth in front and, looks like a rabbit or something like that, then you just, whatever you do a little grinding, you put the veneer, you basically plaster the veneer over it to make it the way it is supposed to look, and he doesn't have to wait a few months to get it straightened out. Is that basically what it is?
That's what it is, yes. Although, if someone has a very severe case of spaces or crowding, then our recommendation would be that they seek a consultation with an orthodontist to have those teeth straightened, because it's better to straighten those out naturally and maintain them that way. However, if a person doesn't have the time, nor do they want to invest in that, then Lumineers is another option that they can consider to still enhance and correct their smile.
Got it. Then there's just a little bit grinding, chipping away, patching on it, and you do it that way. So the tooth inside is still crooked, but you outside, fix it up, grind it, and add to it with the Lumineer as needed, and then looks good. And obviously that's a faster process because you can do that in a visit or two, whatever the situation is, and the patient is good looking.
Well, I want to add, though, that we don't grind away on the tooth because that's excessively aggressive. But what we would do is we would recontour and just gently remove maybe just a small surface, a layer of the natural tooth in order to improve on the aesthetics or improve on the position of the tooth there, because grinding requires a significant amount of removal. Then we go into what we call placement of a crown on there, and that's not the goal of veneers or Lumineers.
Got it. So a crown is when the tooth is probably much more damaged or
that's right,
very out of shape or something like that. Then you put a crown on it, which is all around the tooth, where yet a Lumineer is just on one side, the side which we see. Is that kind of correct?
That's absolutely correct. Our goal as your dentist is to preserve as much of your own natural tooth. If it's damaged significantly, then we might have to go to a different category of restoration. But Lumineers is a very conservative and, like I said, minimally invasive type of procedure. And that's what we want to provide, and that's what most of us as patients would want to have on our teeth as well.
Right. And let me ask you, a Lumineer or a veneer,
yes.
Are they strong? Can I bite into an apple? Can I chew on a spare rib on a nice 4th of July night? What's the deal there?
Those restorations, whether it be a veneer or a Lumineer, they are strong, they are durable. But I also believe that we all have a self-responsibility that we have to take care of the dental work that we have. Because just like your own natural tooth, they can break as well. But if you take good care of them, then they will be well preserved and they will last you a long time.
So as long as you don't strain them overly and try to be funny and do some really weird things. So as long as you just normal eat away and you're totally perfectly fine, right?
They'll be completely serviceable for you, yes.
Beautiful. Thank you very much, Dr. Fong.
Thank you.